If you're a consumer getting ready to turn 65 or retire, or you're an insurance agent, there's several things that you need to talk about. Number one, health. Now, the law prohibits insurance agents from asking you about your health. You might think that sounds a little bit funny, since we're trying to help you position for the best health insurance policy, but the law is what it is. I can allow you to volunteer your health conditions. You can volunteer what drugs you're on, and hopefully you will, but your agent cannot straightforward ask you, which would be a violation of your privacy. So once you volunteered that, that's a very important consideration when we as insurance agents try to determine what plan will be best for you. How about your budget? Now, everybody says in this economy that their budget is tight. How tight is it? Is it so tight that a $20 difference in copays makes a huge difference in your budget? You have to be frank with us on your budget. Now that you're retiring and you're moving to a fixed income, it's going to be much different than when you were working. Are you living with your children? Are you moving to a more expensive state? Are you retiring to a less expensive state? We have to know what we're talking about as far as budget. Travel. That might sound like a strange question. Everybody's dream when they retire is to travel. But I'm talking about your regularly scheduled travel. Do you have children that live in California, Miami, and Nebraska, and you like to spend a week with each child? Do you have a summer home or a winter home in another state that you're consistently out of your state for 3 or 4 more months? Or do you pretty much just stay put? Your whole family lives right here in your city, and you pretty much just stay there. You might take a trip once or twice a year, but nothing that's pre-planned in advance. That's a very important consideration, because if we're going to sell you a network plan, something that requires you to go to a PPO or an HMO, I need to know if you're going to spend a lot of time out of your state, because that could be a big problem. The last thing I like to find out is, what's your relationship with your doctor? Now, that sounds a little strange also, because most people are ambivalent. They like him, they don't like him. Did you inherit him? Did your doctor that you've had for 20 years retire and you just inherited this new guy? Did you just move to town and you had to pick a guy out of a directory? Or are you one of those people that's been to the same doctor for 25 years and you really love that doctor, and no matter what, you're not planning on switching? It's very important, because like I said, if we're talking about a PPO or an HMO network where you might have to switch or pay more to go to your doctor because she's not in the network, we need to know that up front, why we're trying to help you make this very important decision about your health insurance for the rest of your life. So if you're an agent and you need more training, please call us at Gordon Marketing. If you're a consumer and you need to have an agent, we work with agents all across the nation, call us and we'll recommend someone that's in your area.